5 medical tests seniors over 70 should never take. They do more harm than good. At 72, Margaret sat at her doctor's office expecting reassurance. Instead, she walked out with a terrifying diagnosis: possible cancer. But here's the shocking truth. The cancer didn't exist. It was a false alarm, triggered by a medical test she never needed. And Margaret isn't alone. Every year, countless seniors are harmed, stressed, or even pushed into unnecessary procedures because of medical tests that do more damage than good. So today, we'll uncover the 5 health checkups seniors over 70 should think twice about. Some of these may surprise you, and avoiding them could protect not just your health, but your peace of mind. Checkup 1. Colon cancer screenings. For younger adults, colonoscopies are often life-saving. They can detect precancerous growths, called polyps, and remove them before they ever become cancer. In fact, widespread colon cancer screening has been credited with lowering overall mortality from this disease in people under 65. But once a person reaches their 70s, the balance between benefit and risk changes dramatically. Colon cancer typically develops slowly, often over the course of 10 to 15 years. By the time someone is 70 or older, the odds of discovering a brand new, aggressive cancer that could shorten their life are relatively low. If polyps are found at this age, in many cases, they may never grow large enough to cause real harm within the person's remaining lifespan. Put simply, the window of prevention has largely passed. Detecting and removing polyps in your 40s, 50s, or even early 60s can add decades of protection. But after 70, the chance that screening will extend your life is much smaller. At the same time, the risks of the procedure climb significantly. Colonoscopies are invasive. They require sedation or anesthesia, which can cause complications in older adults with heart or lung conditions. There's also the physical risk. The chance of bleeding rises with age, especially if polyps are removed. There's a small but real risk of perforation, a tear in the colon wall that can require emergency surgery. Recovery from even minor complications is harder for seniors, often leading to hospital stays and long healing times. A study published in Annals of Internal Medicine found that adults over 70 had nearly double the rate of serious complications from colonoscopies compared to those in their 50s. Because of these risks, many medical organizations, including the U.S. Preventive Services Task Force and the American Cancer Society, recommend stopping routine colon cancer screenings between ages 70 and 75 unless there is a strong family history or other unique risk factors. Beyond that age, most experts agree, the risks outweigh the rewards. Checkup 2. Prostate cancer screenings, PSA test. Did you know? Research shows that up to 60% of prostate surgeries in men over 70 may have been unnecessary. The reason lies in the PSA test, a simple blood test that measures levels of a protein called prostate-specific antigen. At first glance, it seems harmless. But here's the problem. High PSA levels don't always mean cancer. They can rise because of infections, inflammation, or even natural age-related changes in the prostate. For younger men, catching prostate cancer early can sometimes be life-saving. But for older men, especially those over 70, the story is different. Most prostate cancers detected by PSA screening at this age are slow-growing tumors. They may never cause symptoms, never spread, and never become life-threatening. Yet once the label of cancer is applied, the psychological weight is immense. Very few men want to live with the knowledge of untreated cancer in their body, even when doctors explain it's harmless. And this is where the danger begins. The PSA test frequently sets off a chain of treatments that carry consequences far more damaging than the cancer itself. Surgery, for example, can injure nerves, leading to erectile dysfunction. It can affect the muscles that control the bladder, leaving men incontinent. Radiation brings its own burdens, often creating bowel complications, chronic fatigue, and other secondary health issues that linger long after treatment ends. For many seniors, these side effects permanently reduce quality of life, a heavy price to pay for treating something that may never have caused harm. In other words, the cure too often becomes worse than the disease. Recognizing this, health authorities have shifted their stance. The U.S. Preventive Services Task Force now recommends against routine PSA screening for men over 70. The American Urological Association has reached the same conclusion, stating that the benefits in this age group are minimal compared to the risks. Even the National Cancer Institute has cautioned that overdiagnosis from PSA screening is a significant issue, pushing older men into treatments they do not need. So while the PSA test may appear to be a simple safety measure, in reality, it often leads seniors down a path of unnecessary surgeries, radiation, and lifelong side effects, without extending life expectancy. That is why experts agree, unless a man has unusual risk factors, routine PSA testing should be avoided after 70. And while this particular test mainly affects men, there is an equally controversial screening for women, one that may create far more anxiety than protection. If you have watched to this point, please comment your age, your location, and which test you have done that you regretted. Checkup 3. Mammograms beyond 70. Ask many oncologists, and they'll tell you that after 70, mammograms often cause more harm than good. At younger ages, mammograms can be life-saving. They are highly effective at catching fast-growing, aggressive breast cancers when treatment makes the biggest difference. That's why they are widely recommended for women in their 40s, 50s, and 60s. But once a woman passes 70, the picture changes. Breast cancer still occurs in older women, but the majority of cases at this age are slow-growing and far less aggressive. In many instances, these cancers would never become life-threatening within a woman's natural lifespan. This means the odds of mammogram detecting a dangerous cancer that truly requires urgent treatment drop sharply with age. At the same time, the downsides of mammograms rise. Older breast tissue can look irregular even when it's completely harmless, which leads to false alarms. A suspicious image on a scan often results in callbacks, repeat imaging, and sometimes invasive biopsies. Each step creates stress and uncertainty, sometimes stretching on for weeks, only for the final result to reveal that nothing was wrong in the first place. And even when mammograms find something benign, those findings are frequently treated as though they were dangerous. This overtreatment can mean unnecessary surgeries, exposure to radiation, or medications that carry their own risks. A study published in JAMA Internal Medicine found that women over 70 were far more likely to experience these false alarms than to actually have their lives saved by screening. Dr. Rita Redberg, a professor of medicine at the University of California, San Francisco, put it bluntly, "We're detecting cancers that were never going to be a problem." This is the essence of overdiagnosis, identifying conditions that technically fit the definition of cancer, but never would have progressed or shortened someone's life. Once discovered, however, they are almost always treated aggressively, often at great cost to a woman's well-being. Because of this, medical organizations have become more cautious. The U.S. Preventive Services Task Force currently recommends routine mammograms only up to age 74. Beyond that point, the benefits become uncertain, while the risks of harm become harder to ignore. For healthy women past 70, mammograms are statistically far more likely to lead to stress, unnecessary biopsies, and overtreatment than to save a life. That is why many experts caution against routine screening at this stage of life. But it isn't only cancer screenings that raise concerns. Some of the most common heart-related tests can also create dangers for seniors. Checkup 4. Routine stress tests and heart screenings. Imagine this. You're 75, feeling perfectly fine. Your doctor suggests a treadmill stress test, just to be safe. You agree. The test shows something suspicious. Suddenly, you're scheduled for an angiogram. A stent is placed. Weeks later, another cardiologist reviews your case and says something shocking. You never needed any of it. This isn't a rare scenario. It's a well-documented pattern in cardiology. A stress test, also called an exercise stress test, measures how the heart responds to exertion, usually by walking on a treadmill or pedaling a stationary bike while connected to an EKG machine. It's designed to detect restricted blood flow or blockages in the coronary arteries. For people with chest pain, shortness of breath, or other symptoms, stress tests can be incredibly useful. But for seniors who feel perfectly fine, they often create more problems than they solve. The reason is simple: false positives. As the heart and arteries naturally change with age, these changes sometimes mimic signs of disease, even in healthy individuals. When that happens, The results set off a cascade of follow-up procedures. First comes an angiogram, then possibly a stent or even bypass surgery. Each of these steps carries its own risks, and all of it may be unnecessary if there were never symptoms in the first place. And those risks are not trivial. In older adults, invasive procedures can lead to infections at the catheter site, strokes caused by dislodged clots, kidney damage from the contrast dye used in imaging, or simply long recovery periods that reduce independence and quality of life. For a senior who began with no symptoms at all, these harms can far outweigh any supposed benefit. The American College of Cardiology has been outspoken on this issue. Along with the Choosing Wisely campaign, they advise against routine stress tests in symptom-free individuals, pointing out that there is little evidence that stents or surgeries in these cases extend life or prevent future heart attacks. In fact, most of the benefit comes from lifestyle changes like diet, exercise, and quitting smoking, not from interventions triggered by a screening test. The takeaway is clear. For seniors without symptoms, routine stress tests are far more likely to cause anxiety, unnecessary procedures, and real medical complications than to protect health. If you're over 70 and feeling well, the safest course may be to politely decline the treadmill test. And finally, a test that's become trendy, even marketed as a peace of mind check, but could do the opposite. Checkup 5. Routine full-body scans, CT or MRI. Full-body scans are often marketed as the ultimate peace of mind tool. The idea sounds reassuring. One scan to detect hidden problems before they become dangerous. Clinics promote them as a form of early detection, and many seniors see them as a way to stay one step ahead of illness. But here's the reality. Research shows that incidental findings, harmless spots and cysts, occur in up to 40% of full-body scans. These findings are almost always meaningless. A shadow on the lung could be old scar tissue. A small spot on the liver could be a benign cyst. Calcifications in the brain might simply be age-related. None of these would ever have caused harm. The problem is, once they're spotted, doctors often feel obligated to investigate further. That means more scans, repeat imaging, and sometimes biopsies. Each step carries its own risks. CT scans expose patients to significant doses of radiation that itself raises the risk of cancer over time. Biopsies can lead to infections or bleeding. Even MRIs, though free of radiation, may require contrast dyes that can stress the kidneys of older patients. And beyond the physical risks, there is the emotional toll. Seniors who go in for a reassuring scan may instead spend months living with uncertainty, fearing the worst, only to learn that the finding was harmless. That unnecessary stress affects sleep, mental health, and overall well-being. Medical experts are clear on this. The American College of Radiology and other professional bodies caution against the use of full-body scans for people without symptoms. Their position is that the potential harms, radiation exposure, false alarms, invasive procedures, and emotional distress, far outweigh the chance of finding a dangerous condition early. There's also the question of effectiveness. Studies show that full-body scans rarely extend life expectancy. In fact, when compared to routine, symptom-based care, seniors who undergo these scans often end up with more procedures, more complications, and no improvement in survival. It's important to remember that screening tests are not neutral. They carry consequences, and in the case of full-body scans, those consequences can cascade quickly. For an older adult who feels well, the odds are far greater that a scan will uncover a meaningless finding than a life-threatening disease. That's why many experts say, unless you have specific symptoms or a strong reason based on your medical history, full-body scans are best avoided after 70. What seems like reassurance often turns into unnecessary fear, and sometimes real harm. And with that, we've reached the last test on our list. But remember, avoiding unnecessary screenings is only half the story. The other half is knowing the healthy daily habits that truly protect seniors as they age. Here's the big lesson. After 70, not all medical tests are your friends. Colonoscopies, PSA tests, mammograms, routine stress tests, and full-body scans. They sound protective, but often they bring more risks, stress, and complications than benefits. The key isn't to reject medicine. It's to ask the right questions. Will this test actually improve my care? What are the risks versus the benefits at my age? Is this test being ordered because it's routine or because it's necessary? Because the healthiest seniors aren't the ones who take the most tests. They're the ones who take the right ones. And if you found this eye-opening, don't stop here. Click and subscribe to follow us for more videos.